Alright, y'all. This is me coming at you with an update. Looking kind of crazy. Um, I should really stop saying that about myself, looking crazy, because it's like I really don't look crazy. I just have standards, I guess. So, just wanted to give you guys an update on kind of what's happened in the last couple weeks. So, as far as the journey and things like that. So, I believe I left off and I shared with you guys that I met with a naturopathic doctor, and she recommended that I get the HSG test, and I told you that this is my journey. I was diagnosed with a unicornate uterus. All that. I'm just gonna put that away because it's getting on my nerves. It's distracting me. Um, and sorry, I'm so critical of myself, and I'm gonna upload this anyway because I am critiquing so many things right now, and I need to just not do that. So I had an appointment, or with COVID, a phone appointment with a reproductive endocrinologist that she recommended. One, I wanted to get a second opinion on the diagnosis, just to clear that out the way. So I did that, and I actually really just, it was really actually a cool experience. Like the place where I got the imaging done, here where I live, they were just able to put the images on a DVD for me. So hopefully that if you guys are going through any treatment or you're starting on a fertility journey or anything like that, it will just know that it can be done. Um, so they put the images on a disc for me, and I was able to just drop those off at the reproductive endocrinologist office. So he called me back, and um, his nurse practitioner called me back and discussed next steps. And next steps were to go on the drug Clomid, 50 milligrams, starting day one of my cycle, or cycle day one, and do that for, I think it was 3 to 5 days, and then or no, you started on cycle day three, and then you take it until um, cycle day five. I don't really remember. It's kind of crazy. Anywho, drug Clomid, and then estradiol, which is basically a form of estrogen, while you're taking that. And at first, I didn't know why I was on that. I believe it did kind of cause me to maybe break out a little bit, like this here. And then I had a pimple here. And I don't usually get breakouts unless it's like around the time of my cycle. And I try not to pick them. Because other than that, I have a pretty strict skincare routine. So I try to take care of my skin. So, no negative side effects or anything like that with the Clomid or the, excuse me, estradiol. So, for those of you who don't know, the drug Clomid is supposed to force your body to ovulate. Now, I already ovulate, but giving the condition of a unicornate uterus, where I have, in my case, I have two ovaries, and but I have one fallopian tube on the left side, so I don't have a right fallopian tube. So they wanted to force ovulation. The doctors recommended forcing ovulation to see where I was ovulating from. Some women alternate from month to month. Like sometimes the egg comes from the right ovary, and sometimes it comes from the left. Or half your life you can ovulate from one side, one ovary, and the other half of your life you can ovulate from the other side. So they recommended to take the Clomid to force my body to ovulate, and then I would go in for an ultrasound around cycle. it was about 5 or 6 days later, probably about a week later, around the time ovulation is suspected to happen. And yeah, I was just thinking about something. They would see how the mature eggs that were there and about to be released. They say with taking Clomid and forcing ovulation, there's a 5 to 10% chance of twins and a 1% chance of triplets. So definitely didn't want the third option. I was okay with the second as long as everything was healthy. Usually with women with a unicornate uterus, you just want to shoot for one because you just want to make sure a baby has enough room to grow inside the shape of the uterus. So started the drug, went in and had the ultrasound, and was excited. I got good news from that. So they went in, they checked the right ovary, and they look for the eggs to be a certain size to consider them mature. So on the right side, I had about 2 eggs. They were about 9. I'd be messing up the measurement system. I want to say millimeters, but that could be so wrong. Anywho, they look for 12 and above. So on the right side, it was about 9 and 7. And they're like, well, that's kind of okay because we're not really looking at the right side. We want to make sure this left side is good. So the left side, I had 3 mature eggs. I had a 12, I believe a 15, and I had a 21. So I had an overachiever there. And so what they did was they then gave me an HCG trigger shot, which that is another thing that forces those eggs to release. That was on the 12th. And then on the 13th, we had to go separately, my husband and I separately because of COVID, and we went in for an IUI. So an intrauterine insemination. I think more commonly it used to be called like an AI, an artificial insemination, which I don't really like that term, but it's fine. So I went in for that on Thursday. My husband created a sample and it was washed. So at first I was like, you're gonna have to explain to me what these terms mean because this is against the natural process. So it was just washed to basically they go in with a microscope and make sure all the premium sperm are being injected, and not any mutated sperm or anything like that. So he had a sperm wash, and I had an IUI on the what's today? I had an IUI on the 13th, I believe. Yes, the 13th. So earlier this week. So I'm now in the 2-week wait to take a pregnancy test. I'm freaking out. I'm excited, and I am trying to just make sure that I'm taking care of my. This is not the best angle for me. Sorry, I'm literally sitting on my bed. There's a pile of laundry here, so just so you know. Just being transparent with you guys. So, yeah, there's just, I'm excited. I'm just trying to relax my body before this test. I'm trying not to think of, oh, that's a symptom, you know. I just don't want to do that to myself. So, I've just let a few people know, a few friends and family members that are closest to me. And that's all that really knows. Just, I really wanted that support and I wanted their prayers and things like that. So that's where I'm at. I mean, I will come back in 2 weeks, whether it's the news that we've been praying for and desiring or not, and just give you an update on how I'm feeling and how things are going. So I'm remaining hopeful. And because things just worked how they were supposed to, as far as the medication, as far as my husband's sperm, as far as my eggs on that right side,